Hey everyone, this is Kyle with the Dental App, and I wanted to walk through a new feature that we just released today. That is the new treatment picker design and workflow, as well as the ability to customize the options that are available to you there. So you'll notice in the patient chart here right off the bat, the design is a little bit updated. You can still toggle through whether you're adding treatment needed, existing restorations, perio at the top here. But then obviously the biggest change would be the shift of the treatment picker being over here to the right hand side now. This still gives you the same top level categories that you can toggle through, but these options are all customizable now and a little bit easier to navigate around. So if we select a couple teeth here, it'll enable all the buttons that only have treatments here dedicated to a tooth. And so we can go in and start to build out our treatment that way, just like we did before. Of course, if there's not an option that you have selected in your quick picks here, you can go to search treatments and find anything that you need that way as well. Refer treatments, mark teeth as missing, switch dentition, and add conditions. So the real power in this though is being able to customize all of this. So if we go into our settings, and I'm going to open this in a new tab so that we can kind of view both here. So you'll see by default under the clinical section under settings, there's two, one for main and one for the main existing. And so this is, we have defaults for treatment needed, or if you're in existing restorations, there's a new picker options that kind of pop up for you. And if we go into one of these, you can kind of see how this is laid out. So you have your top level categories, and then within those categories are going to be the selections that are available. So if we wanted to add a new one, for instance, we'll just add like a comp exam. Choose our treatment, search for D150, and choose that, and then we can save that. And now if we go back to the chart and refresh, we'll go back to treatments needed, and there's our comp exam that's available now. So you can see that this is really powerful to kind of build out how you like to treatment plan and work with patients, and kind of customize this to your liking. Some pretty sensible defaults set here for you out of the box, but you can go through and change that as you'd like. Of course, the real power as well with this is being able to set up different treatment pickers based on different types of treatment planning. So for instance, you might have maybe someone who's an ortho specialist, and so you could set up a new let's do like Invisalign, a new treatment picker just for this particular type of treatment planning. And maybe you're adding sorry, bear with me, just add this in real quick. So we've built out, of course we would build this out with all the different options that you'd like, but if we go back to the chart and refresh here, you can get to all of the treatment pickers that you've built by clicking this cog in the top right. And so now we could toggle over to the ortho view and have the options that are available for that particular treatment planning session. So super powerful to be able to build all this out and customize it to your liking. Different providers may have different preferences, and they can kind of set up their own options for doing that. As far as building this out, I'm going to go back to the main view here real quick. And the way this kind of works, you'll see some of these have multiple codes attached to them. So this is something we do automatically. A good example of this is the resin composite. And so, for instance, if I was to add this code up here, just as an example, so we'll add a treatment and choose resin. Or name it resin, and then we'll just put in the code, one of the codes, 2391. So you'll see what happens when I choose this. It's actually going to add all of the codes that are the same treatment. They just have variations based on number of surfaces, anterior, posterior, and so forth. All of this kind of happens automatically out of the box for you. And what this will do in the chart is, if we select a few teeth here and go to pull up our main treatment picker again. We'll go to composite and choose resin. Now, based on the number of surfaces that I choose, as well as which tooth, if I add this, down here in the chart, it will correctly select the treatment based on number of surfaces. So you see we chose 2 surfaces, an anterior tooth. Here's a posterior tooth, 2 surfaces. So it kind of gives you that auto code functionality out of the box. And so that's the way that works. And then another functionality that's here is you can actually group treatments. And so if we do add group, let's do one maybe for implant. Can't spell today. All right. So we're going to choose the treatments that we want to go with this. So let's do implant supported crown. I think surgical placement. So we're going to choose these 2 treatments for our implant group and save that. And so you'll see here, these are grouped under this one section here. And if we go back to the treatment picker and refresh here, now I can choose a tooth, and I'm just going to delete all of these existing treatments to make it a little bit easier to see. Okay, and then so we've selected this tooth here. We can go and choose implant. And when we do that, you'll see that it adds both of the codes that we had selected there. And this will also follow, of course, we would want to mark this tooth as missing as well, so we just see the implant there. This will also follow the same logic of the auto code. So if you have codes that are attached in the group that are dependent on number of surfaces and all that, it'll still follow the same logic and choose the correct CDT code for you. So that's a basic overview of the new treatment plan picker. Again, you can customize all of this to your liking. If you have any questions, of course, reach out anytime, and we'd love to help you get things set up exactly the way you want it. And we'll see you next time. Thanks.